Welcome to Hardemil Dental Clinic. My name is Christian Mill, and with this very interesting presentation, we'd like to show you how we can replace broken or missing front teeth in one day. You can see here the initial situation, and you can guess the problem. The upper left front tooth is so severely damaged that we have to take it out. You can see here, after the crown removal, there's not much tooth substance left, so it's almost impossible to place a crown on that tooth, which will last you a long time. Additionally, this tooth had an infection at the very tip of its root, so this tooth needed to be taken out. Of course, in the old days, we took out the tooth, waited 3 months, placed the implant, waited 3 months, and then placed the crown. So you had an intermediary period of approximately 7 to 8 months where you didn't have the proper tooth. Nowadays, we can do that differently. We do all of that in one day. That means we take out the tooth, like you've just seen, and this is the empty place where the tooth has been. It is very important that you are very careful when you remove the tooth. And directly into that hole, you can place the implant. Before that, of course, you have to remove all the inflammation and all the inflammatory tissue, indicated here with a small yellow arrow. When you've done that, like I said, you can immediately place the implant, seen here. You have to be very careful that you place it in the correct position. And this surgery normally does not take longer than 20 to 30 minutes, but the precision is very important. You can see here the implant placed in the correct position, indicated by the yellow arrow. You can see a small soft tissue graft, indicated by the blue arrow. This soft tissue graft gives you a little more thickness and a little bit more protection in the face of resorption, of bone resorption. And then you can see here the temporary solution on the day of the surgery. On the top left, you see the stitch which holds the palatal soft tissue graft, the free gingival graft, how it is exactly called. The situation now looks a little bit severe, but approximately after 2 weeks, it will be fine. You have to wear the temporary on the implant for approximately 3 months until we know that the implant is safe and sound and properly integrated into the bone. And after 3 months, you take an impression, and 2 weeks later, you have the final crown. You can see here, this is the soft tissue, absolutely in perfect shape. And if you take an X-ray, you can see the implant sufficiently grown into the bone. The very white part indicated by the blue arrow is the implant abutment, and the crown indicated here by the green arrow is cemented onto the abutment. So again, yellow arrow implant, blue arrow abutment, green arrow, the final cemented crown. Thank you very much for your kind attention.